The continuum of 21-OH deficiency in congenital adrenal hyperplasia, or CAH, impairs cortisol synthesis. Consequently, excess cholesterol-derived steroid hormone precursors, such as progesterone and 17-hydroxyprogesterone, are shunted to androgen synthesis. The lack of cortisol also results in a loss of negative feedback in the hypothalamic-pituitary-adrenal, or HPA, axis. Without this negative feedback, the hypothalamus continues to secrete corticotropin-releasing factor, or CRF, leading to ongoing activation of CRF type 1 receptors and excess production of adrenocorticotropic hormone, or ACTH, that is released into broad circulation. CRF is a primary regulator of the HPA axis. In people with CAH, continued CRF release drives overproduction of both ACTH and downstream adrenal androgens. Interfering with CRF binding to CRF type 1 receptors could provide a targeted way to reduce ACTH and downstream androgen overproduction and allow for lower doses of high-dose glucocorticoids, or GCs. With CRENESSITY, this is finally possible. Crenessity is the first and only CRF type 1 receptor antagonist that is FDA approved to treat classic CAH. By selectively blocking CRF from binding to CRF type 1 receptors in the pituitary gland, Crenessity directly inhibits ACTH secretion to lower circulating levels of ACTH. In patients with CAH, excess ACTH secretion leads to chronic overstimulation of the adrenal glands, an overaccumulation of steroid hormone precursors, and excess production of adrenal androgens. Because Crenessity directly reduces ACTH secretion, it also leads to a downstream reduction in adrenal androgens. This in turn allows for lower doses of GCs. For 70 years, high doses of GCs were given to both replace missing cortisol and engage the negative feedback loop in the HPA axis in an attempt to control ACTH and androgens. However, this has required a balancing act to weigh the side effects and comorbidities related to high-dose GC use against the symptoms of poor androgen control. And when taking GCs alone, 2/3 of patients with CAH still have poorly managed androgen levels. More direct reduction of ACTH secretion and downstream adrenal androgen production. Crenessity is a breakthrough therapy that can transform the way we think about CAH. Indication: Crenessity, crinecerfont, is indicated as adjunctive treatment to glucocorticoid replacement to control androgens in adults and pediatric patients 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Contraindications. Crenessity is contraindicated in patients with hypersensitivity to crinecerfont or any excipients of Crenessity. Warnings and precautions. Hypersensitivity reactions. A hypersensitivity reaction, including throat tightness, angioedema, and generalized rash, occurred in a subject after 3 days of treatment with Crenessity. If a clinically significant hypersensitivity reaction occurs, initiate appropriate therapy and discontinue Crenessity. Risk of acute adrenal insufficiency or adrenal crisis with inadequate concomitant glucocorticoid therapy. Acute adrenal insufficiency or adrenal crisis, which is potentially life-threatening, can occur in patients with underlying adrenal insufficiency who are on inadequate daily glucocorticoid doses, especially in situations associated with increased cortisol need, such as acute intercurrent illness, serious trauma, or surgical procedures. Continue glucocorticoids upon initiation of and during treatment with Crenessity. Do not reduce the glucocorticoid dose below the dose required for cortisol replacement. Patients should continue to use stress dosing of glucocorticoids in cases of increased cortisol need. Adverse reactions. In adult patients, the most common adverse reactions, at least 4% for Crenessity and greater than placebo, are fatigue, headache, dizziness, arthralgia, back pain, decreased appetite, and myalgia. In pediatric patients, the most common adverse reactions, at least 4% for Crenessity and greater than placebo, are headache, abdominal pain, fatigue, nasal congestion, and epistaxis. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. Crenessity is available in 50 mg and 100 mg capsules and as an oral solution of 50 mg per milliliter. Please see full prescribing information.